moving on to our toilet training principles. Okay, so again, recap, healthy bowels is you're going up to 3 times daily or 4 times a week. It should be soft, light brown, easy to pass, and round about a type 3 to 4 on the stool chart. Healthy bladders, okay, good volume, 4 to 7 times per day, pale yellow, not overly offensive, okay, and usually about a type 1 to 3 on the wee chart. So being toilet trained is recognising the need to pass urine or open your bowels in an acceptable location, and that a person's best level of continence may fall anywhere from complete toileting independence to any level of semi-independence with prompts, visuals, physical support, continence products. So I always look on toilet training as a marathon rather than a sprint. And what I find is that a lot of parents, once they've got their kids out of nappies, take the eye off the ball. And then things start to deteriorate. And toilet training is the biggest milestone that you will ever go through with your child. And you want them to reach the very best that they can be. So the signs of toilet training readiness. And I cannot stress highly enough that they do need to have healthy bowels. Okay, that will be the biggest factor that will impact on successful toilet training. You know, are they able to show discomfort when they're wet or soiled? The primary caregiver has to commit 3 hours a day to getting the child or the person toilet trained. So it's a huge, huge, commitment. And I would say that, and I've said it to a lot, is that if you have got, as the caregiver, the parent, whatever, if you've got a gut feeling that we can do better, or this child could be toilet trained, okay, then it's worth giving it a go. It's worth giving it a go. The longer you leave it, the harder it will be. Like there was an 11-year-old who was still incontinent and still in pull-ups when mum contacted my service. Well, a year later, we're getting there, and that he's in pads now, but it just takes a lot longer. So it's, if you know that it's better to start early if you think they are able. This is my 7 P's for toilet training, okay? And there's actually 17 steps. I counted, I broke it all down. And there's actually 17 steps involved in learning toilet training. So no wonder it's hard. No wonder it's hard, okay? So for the first part, plan. And I look on the caregiver, the parent, is the director. So they have got, they've got to get their orchestra together, and they've all got to be on the same song sheet. Okay, they've all got to have regular meetings, and really, look at What are you really wanting for this individual? Okay, so you've got to kind of look at that for you know, the person that you want to work with. You've got to look at, as part of the plan, is the baseline. You've got to know where they're at now, so that you can actually then in a month's time or 2 months' time look back and say, hey, you know, we're actually, we have, you know, because sometimes when you're doing it you think, oh, we haven't got very far, but you actually have when you look at you know, what their baseline data was. You get these diaries that they are on the website, the Continence New Zealand website, that you'll get these bowel and bladder diaries there. And that will identify problems. Okay, do they have constipation? Do they have problems with their bladder and soiling? Okay, and look at during the plan some of the additional things that you need to be thinking about. Okay, looking at the equipment and like we mentioned earlier about ensuring that the environment is a nice place for them to be in, but also are they sitting in the right position as well on the toilet. And looking at you know, behavioural currency. It'll be different for every child. What will motivate, or one individual, what will motivate one may not motivate the other. I've tended to find edible rewards work really well, like little M&Ms straight away. Okay, immediate reinforcement, fantastic. You really did some good toilet sitting there, even if it was only for like 10 seconds or something, all right? And again, we've mentioned we're going to be bringing play to help them relax, to help them reduce their anxiety and take their time on the toilet. And there's lots of things out there. I didn't bring it with me, but you know, with some kids, we have a lot of fun with the shoot the poop game. There's little Miss Wee in there. But the shoot the poop game, role modelling, visuals is, you know, you have a lot of these visual toilet sequencing charts, but they said you actually need pictures of the child, actual pictures of the child going through that sequencing of getting them on the toilet, okay? And again, lots of practice, okay? And there will be lots of you know, accidents, and you might just start off they just sit on the toilet for 10 seconds and off, and then you just gradually you know, increase it. You might just, if they're too frightened to do that, then say, yeah, just sit them on the toilet with the pull-up on and off, and just getting them used to it. The minute they become upset or stressed, you just really have to, you know, back off. Okay, labelled praise. Okay, clear communication that you've done, you know, brilliant sitting on the toilet. All right, and you had your, you know, great. You've got your feet on the stool. Okay, and that you've done some really good blowing. So be specific and immediate, and you know, with the praise. And patience. Okay, certainly with my son, I needed an awful lot of patience because of his chaotic, challenging behaviour. And I learnt to be a duck. And basically you see this lovely duck here, and it's calm and serene, you know, going along the pond, but underneath your feet are going like the clappers, your heart is beating, and I was often like that during periods of meltdowns with my boy. And toilet training will be the hardest days sometimes, because often the mess and the frustration that is actually involved. But it is important that we remain calm and consistent and just keep it and commit to it. If it's getting too much, we've all got a limit, haven't we? We've all got, oh God, you know, and take yourself away and let somebody else, you know, step in, or sometimes you do just have to give yourself a bit of a break from that toileting journey. Yes, perseverance, okay. It will be the hardest days, but it is worth it in the end. That that you cannot have success without persevering, without carrying on. Okay. And I used to say this quite a lot. You know, it wasn't just toileting, you know, that I was trying to help my boy with. Social skills, lots of different skills. Even just getting him into the habit of cleaning his teeth morning before he went to bed in the morning. It was just constant, you know, and it is tiring when you're repeating yourself over and over and over again. It's like, when are they ever going to get it? And that's the thing with, you know, people with neurodiversity like autism and FASD, is that some, and I call it like a light bulb with a short in it. Some days that light is shining bright and they're awesome, they're fantastic, they're doing everything that you're prompting them and asking them to do, all right? Other days, that light is flicking on and off, flicking on and off. And these are the days it's like, oh, you know, I don't know if I'll push them too much. I'll just go a bit more gently with them. I'll just, you know, because the chances are they'll land up going into blast off and having a meltdown. And my meltdowns with my son would last 2 or 3 hours, so I had to be a really good duck. And then other days, the light bulb just wouldn't go on at all. And these were the days that would be, oh God, you know. And yeah, I would not send him to school and just, yeah, not send them to school and just not put any expectation on him at all. So you're going to get that with individuals like this, and you have to just be aware that there will be some days where I call it exhaustion. I've had over the years had severe exhaustion, and that you know, when you're looking after an individual with very complex, diverse needs, there's predictability in the unpredictable. You just never know what you're going to get from one day to the next. And toileting is only, you know, part of that journey. And some days the toileting is great, and some days the toileting will just go out the window. And you just kind of have to, yeah, just go with it, really, okay, and deal with it in as practical a way as you can. And yes, I've felt, you know, as a parent, I've felt all of these things. And it's okay to fail. Okay, it's okay to reset. Go back to where the person's coping. Gather your team together and just, right, you know, this hasn't worked. What else do you think we should try? And this picture here is actually from Scottish history, which is Robert the Bruce when he was fighting the English and they were getting slaughtered. And he went and hid in a cave and he watched this spider, and the spider was kind of going up, but it would fall back down again. It never quite got to the top, and it would fall back down again. And he learned that you just have to keep trying. You keep trying, and eventually, you know, we'll get there, and not to give up. So it's okay to fail.